Assalamu alaikum wa rahmatullah wa barakatuh. This is lecture notes on restoration of endodontically treated teeth. As an outline for this lecture note, after the introduction we will talk about the objectives behind the corona restoration of endodontically treated teeth. What are the factors to be considered while planning the final restoration of endodontically treated teeth? Then the corona restoration of anterior then posterior endodontically treated teeth. ابتداء نعرف أهمية هذا التوبكس. بالحقيقة the success of endodontic treatment depends on the quality of root canal treatment and the coronal restoration. Now, what is the specific regarding the endodontically treated teeth? بشكل عام, it is accepted that the endodontically treated teeth have lower lifetime prognosis because they are weaker to have lower physical properties. Why? Because they are significantly affected by caries, fracture, large and or repeated restoration. ثانيا, there is a reduction in the level of proprioceptive fiber which can lead to uncontrolled occlusal force. In addition to that, there are further weakening by the endodontic procedure like the access opening, root canal instrumentation. Besides that, they have altered physical properties like the decrease in the micro hardness, in the elasticity, shear and tensile strength. What's the cause? What is the cause behind this alteration? Firstly, because of the loss of moisture due to the loss of pulp vitality. هذا الشيء هذا يعني إن loss of unbound water from the root canal space and the dentinal tubule because of the loss of vitality. ثانيا, because of the usage of the endodontic irrigation. بعض أنواع الirrigation تسبب decalcification and demineralization of the dentin like the acid and the EDTA. والبعض الآخر like sodium hypochlorite يسبب denaturation for the protein. هاي الأسباب أدت إلى أنه الروت كانال تكون weaker than the tooth with vital pulp. What are the objectives of final restoration? أولا, we have to restore the function and the aesthetic. ثانيا, provide adequate retention and resistance for the coronal restoration. ثالثا, we have to protect and preserve the remaining tooth structure from fracture. ثم prevent reinfection by providing coronal seal for the root canal system. During the planning for the corona restoration, we have to consider many factors اللي راح تأثر على choice of the treatment of choice. من عندها الامount والquality of remaining tooth structure لأن لها تأثير مباشر على fracture resistance retention of the restoration. الفاكتور المهم الآخر هو occlusal force on the tooth and the opposing dentition. ليش؟ لأن excess occlusal force can predispose tooth fracture. قد تسبب post fracture أو تسبب debonding or composite core fracture. من هذا الفاكتور occlusal force بعلاقة مباشرة ب position. الفاكتور الآخر هو position of the tooth in the arch. another factor is the aesthetic requirements. الانتيريور requirements مالتها تختلف عن البوستيريور خصوصا باختيار التايب of the post. الفاكتورز المهم الأخير هو length, width والcurvature of the roots. In order to decide the correct corona restoration for anterior teeth with the root canal treatment, we have to keep in our mind two important factors: the amount and the quality of the remaining tooth structure and the occlusal load. If we have case of tooth with minimal loss of tooth structure, for example, just the access opening with or without class 3 or class 4. So the restoration of choice is the direct composite restoration. But if we have case with larger cavity where the residual tooth structure greater than the half of the tooth with good fural effect, longer fural effect. In this case, we have to look for the occlusal load. If we have limited overbite and functional effect, so the restoration of choice is the adhesive core and full crown. But if we have deep bite, overbite and increased functional effect, so the restoration of choice is the post and core followed by full crown. In case with larger cavity and more loss of tooth structure, where the remaining tooth structure less than the half of the tooth with limited fural effect, so we have to select the post and core followed by full crown. This is example for the cases with minimal loss of tooth structure, where just the access opening or with or without class 3. In these cases, we just restore the access opening with the class 3 with composite restoration. In some cases, we have discolored teeth, so the bleaching should be preceded the final restoration. Where in case when the discoloration persists or bleaching resistance, we have to consider veneering for the tooth as a or in addition to the restoration of the access and the cavities. If we have cases with more loss for the tooth structure, but it is less than the half, the loss is less than the half of the tooth structure. In this case, the treatment or restoration of choice is the adhesive core followed by full crown. This is in case when we have limited functional stress or limited overbite. But if we have deep overbite or increased functional stress, we have to restore the tooth with a post inside the canal, extended inside the canal, in addition to a core, which followed by full crown. If we have case where the remaining tooth structure less than the half of the tooth, more destruction, so the treatment of choice or restoration of choice is the post extended inside the canal, in addition to the core, which followed by full crown. Previously, we mentioned the term of ferrule. What is the ferrule? It is the circumferential ring of sound tooth structure that is enveloped by the cervical portion of the crown restoration. It forms by the supragingival walls and margins of the tooth. The minimum thickness for the ferrule about 1 millimeter, and the minimum height for the ferrule between 1 to 2 millimeter. Now, what is the function of the ferrule? Firstly, increase the fracture resistance of the tooth as it dissipates the lateral force that concentrated on the cervical area. This is the case when there is no ferrule. There is no dissipating for the lateral force and increased possibility of the fracture. Second function for the ferrule is by increasing the retention and resistance of the coronal restoration. So it will decrease the leakage. This is by increasing the axial wall length of the prepared tooth. Another function is by protecting the root integrity by providing bracing action. The excess cavity preparation for root canal treatment of anterior teeth, in addition to the crown preparation, cause weakening for the tooth structure. These, in addition to the narrow tooth dimension with the predominant shearing force, all these make the restoration with the post is the treatment of choice. However, the post of no or little no benefit in case of sound tooth structure, or it may cause further stress and increase chance of failure. We have case of posterior tooth with root canal treatment that needs coronal restoration. We have to keep in our mind the amount and the quality of the tooth structure and the functional load. So, if we have axis opening with a class 1, class 2, if it is a conservative axis opening where the thickness of the wall about 1.5 millimeter more or more with limited functional load, so the restoration of choice is the direct or indirect restoration. Indirect restoration, we mean by it the inlay. But in case of larger cavity where the thickness of the wall less than 1 millimeter or increased functional load, the restoration of choice is the indirect composite restoration overlay. This is because we need to protect the cusp. In cases where we have further destruction of the tooth structure, but still the remaining tooth structure is greater than the half of the tooth structure with limited functional load. Here we can select either endocrown or core build-up followed by full crown. Massive destruction of the tooth structure where the remaining tooth structure less than the half of the tooth structure with increased functional load make the treatment of choice is the post-retained restoration. These are cases with limited loss of the tooth structure, class 1 or class 2 or DO, where the thickness of the cavity walls more than 1/2 millimeter. So the treatment of choice is the direct or indirect restoration without the need for the cusp coverage. But if we have large cavity where the walls of the cavity of thickness less than 1 millimeter, we have to protect the cusp. So the treatment of choice is the overlay, especially when we have increased functional or lateral stresses. In case when the residual case when the residual tooth structure is more than the half of the tooth structure with limited functional load, the restoration of choice is the endocrown or a composite core or amalgam core followed by a full crown. But if the residual or remaining tooth structure is less than the half of the tooth with an increased functional load, so we have to use a post-retained restoration. This is a post extended inside the canal. This is the core. It is either amalgam core or composite core. After preparation, it will receive a full crown. This is an example for a conservative excess opening. We just restored the excess opening. This is the X-ray. This is the inlay for the center of the tooth and in between the cusp. Then this is the onlay extended to cover the cusp, while the overlay involved all the occlusal or biting surface. As we said, if we have a case when the residual tooth structure is greater than half of the tooth with limited functional load, the restoration of choice either an endocrown when we have an advantage from the pulp chamber. It is an overlay. Use the pulp chamber to provide the required retention. Or we can restore the tooth with an amalgam build-up followed by crown, or composite build-up followed by crown. If we have case with massive destruction in the tooth structure where the remaining tooth structure less than half of the tooth structure, so the restoration of choice is the post-retained restoration. Started with the removal part of the jabbar from inside the canal, providing space for the post insertion, which is inserted inside the canal. After that, the tooth crown will restored with the aids of and build with the aids of composite. This is the final result of build-up and preparation to receive crown. this is quiz for you, um, a challenge for you about your understanding for the lecture and the information. Firstly, what is the changes that caused by the root canal treatment? Um, then answer will be true or false. The crowns, the statement that the crowns should be placed on all root canal treated teeth. Is it true? Which endodontically treated teeth required crowns most of the time? And what is your suggested treatment for this case? Finally, thanks a lot for your kind attention.